Yesterday, the doctor gave me these. Take 1 tablet by mouth every 4 to 6 hours as needed for daytime pain. On the back, may cause drowsiness, alcohol may make this worse, use care when operating a vehicle, vessel, or dangerous machinery, may cause dizziness, taking more of this medication than recommended may cause serious breathing problems. Somehow seems worse, maybe, than the pain. In light of that, I bring to you a performance warning label. This performance may cause hypochondriac reactions in others. Do not attempt to watch or control while tired. Attempt to feel comfortable with cussing and use of the word fat. To find inspiration for this performance, look to the work of Kilgard and Fox. This performance may leave you distrustful of your doctor and others who seek to examine your body with an outside eye. I enter the doctor's office with a special knowledge. It's the knowledge that my body is not good enough. This body of mine with its fat and love handles and big-bellied curves is not the right shape. This body of mine that carries with it a history of genetics, 2 heart attacks from my parents, multiple heart attacks from grandparents. My body is red before I get a chance to speak. The doctor's office leaves me ashamed, distrustful of my self-knowledge and the body I live in. And at the doctor's office, these are always 2 different entities. The body that I live in and the knowledge that I carry for myself. A disconnect. And the longer I stay at the doctor, the more I become an injured arm, a cold, a cough, an ear infection. In this case, a swollen knee. At my first PAP, the woman looked at me and said, "And how is the vagina feeling today?" I think I looked pretty confused, and so she asked again, "And how is the vagina feeling today?" I didn't know that my vagina had its own set of feelings. Wonder if I should talk to her more often and inquire as to how she is doing. Maybe she feels frustrated that she's left out of the rest of my body's feelings. Well, I feel stressed out that use of the word vagina often causes uncomfortable reactions in people. And when I get stressed out, I vomit. And before you ask if I've been to a doctor about this, yes, I've been to multiple. My first doctor told me it must be something you're eating. I told him I think it might be stress. It's probably something you're eating that you're sensitive to. I said, I think it might be stress. It's probably something you're eating you're sensitive to. I could no longer speak above a whisper. Months later, I go back. I told my doctor I have full body aches that I think might be related to anxiety. You see, this was pre-acceptance into a PhD program. My test tightened as I was applying when anybody mentioned or asked me how applications were going. At a conference, I couldn't keep food down. I hid in a corner of a Disney World hotel screaming into a phone that I could not do this before one of those networking parties. Mickey Mouses and Minnie Mouses surely dancing somewhere in the hotel in a joy that I could not understand or get close to. So my doctor gave me a jar of Valium for stress. But Valium can add up and can be addictive, especially if this body I have carries with it a history of addicts. But that wasn't asked about. And I wasn't quite strong enough to not take the prescription. You see, Valium is the only time my brain is ever quiet. When I tore a muscle in my back, the hospital gave me a nice combination of Valium and Vicodin to take. 3 Valium a day, 2 Vicodin every 4 to 6 hours. The Westboro Baptist Church could have picketed my house, telling me that my queerness caused 9/11. I would have invited them to stay for dinner and poured them drinks on Valium. So I only took 1 Valium because I wasn't ready to stop fighting. A combination between lack of funds and distrust of doctors has taught me to inquire elsewhere about my health. I turned to Dr. Internet. I Google stress vomiting. WebMD responds with, "Lots of things can leave us queasy or give us a stomach ache. Viruses and bacteria are major physical causes of nausea and vomiting, but so are our emotions, especially anxiety, stress, and excitement. If anxiety and stress become overwhelming and you're dealing with the physical pain of that pressure daily, be sure to reach out and get help." At a loss of how to de-stress, I try following a more balanced diet. Perhaps the vomiting is something related to the physical. But whenever I get stressed out, I still vomit, so I return to Googling. And I see a hidden bullet point. For further reading on stress, see cancer and stress-related diseases. It's a cycle, you see, a cycle that I check WebMD to find out that vomiting and stress may be a symptom of cancer and a cause of cancer. And I worry about the loss of a connection in me and a doctor, but I worry far more about the doctor and her advice. And I can't actually say the word cancer too loudly, because in my family, this is one of the ways you got it. When you say it out loud, it comes for you. And I wonder if searching the internet will also seek to bring it. In my life, I have played rugby, competed in judo collegiately, and done bodybuilding. It's left my back wrecked, and I'm consistently concerned because really no amount of stretching seems to help. No amount of ice. I just feel pain, so I Google. The first website that pops up is Cymbalta.com. Learn more about chronic low back pain. Find out about the possible chronic low back pain risk factors and chronic low back pain treatment options. Cymbalta is a non-narcotic prescription medication approved by the FDA to manage chronic musculoskeletal pain due to chronic low back pain. Musculoskeletal sounds very bad, even though I know it's just a descriptor of where the pain is. And I realize pain is getting worse and I should probably see a doctor, but my concerns remain. I worry about being overlooked, but more often I worry for going and finding out about a much larger shame. Every single time I am told that losing weight will cure everything. Of course, not in so many words, because it's not as simple as that. But my doctor's cure for everything is lose weight. And before you protest and say that's just your doctor, I've moved 3 cities in the past few years, and every doctor I go to, that's their suggestion. Vomiting, lose weight. Dandruff, lose weight. Psoriasis? Drink water, it'll help you lose weight. Achy joints, lose weight. Never mind you played sports for years. Exhaustion, lose weight. Oh, you're in grad school? Lose weight for that too. Muscles aching, lose weight. Sinus infection wouldn't hit you so badly if you lost weight. Sprained ankles wouldn't have felt as bad if you weighed less. Try that out. Try that out, weighing less. Check. Ear infection, lose weight. Most recently, I went to the doctor for a physical. Everything looked good, blood panels included, and the doctor looked at my charts and said, oh, your parents both had heart attacks. You are at risk because of your weight. I told her my dad had his heart attack at his thinnest, and both his and my mom's were more stress diagnosed. Well, she said, your weight may not be your largest factor, but it is a huge one. Huge one? Was she serious? The pun hung in the air for me to hear over and over, a huge one. I wonder if she heard herself, or if she knows the shame will stick with me for days. And she ignored my own research and knowledge over and over. It seems as though if I lost weight, everything would magically fit into place, but losing weight doesn't take into consideration me or any actual research on weight loss. As Alafante 2012 shares in a beautiful poem titled Yesterday, I thought that because I'm fat, eating was a bad habit. Yesterday, I didn't know that with a minimum of research, anyone can discover that we eat just like thin people, and in many cases, our calorie intake is less. Yesterday, I had no idea that weight loss programs don't work. Instead of correcting eating and health problems, they create them. Yesterday, I wouldn't have guessed that society had an interest in my self-hatred. The economic establishment has brainwashed us so thoroughly that women willingly offer themselves up to starvation and mutilation rather than look like me. Yesterday, I never realized that I didn't have to wait until I lost weight before I lived my life. That I have a right to go after any job I want, eat wherever I feel hungry, and to question any of the long-winded bullshit findings of the medical research profession. Yesterday, I didn't know that fat women can dance, swim, play, and groove right along with the best of them. Yesterday, I never thought that I would have a lover that adores me, and not because of or in spite of my fat. Yesterday, it hadn't dawned on me that I don't have to buy into the lies that fat people are lazy, less deserving, incompetent, and have no guts. Yesterday, I didn't know that I have a right to be treated with human respect in any and every facet of my life. Yesterday, I didn't know these things, but I do know now, and my life will never be the same. And my own addition, you see, yesterday, I listened to all the voices around me. But today, I become a joyful voice for myself, dancing 6 to 8 hours a week, usually. And now I dance for joy, for health and release, but I don't dance for loss. I dance to de-stress, but it doesn't help with back pain. I have nightmares where I cannot move and I cannot breathe, and when I wake up, it takes moments to try and get into position to breathe. And I return to my doctor in search of something, anything to help with the pain, and he tells me to de-stress.